Uganda currently has a population estimate of about 45 million people. In the southwestern part of the country is Bwindi National Park, at the junction of the plain and mountain forests. This natural endowment covers almost 32,000 hectares and is also known for its exceptional biodiversity, with more than 160 species of trees and over 100 species of ferns. Bwindi's misty hills are a sanctuary for many rare and endangered species, including almost half of the world's mountain gorilla population, the Great Lakes Batwa are believed to have migrated from the Itusi forests of Democratic Republic of Congo and are believed to be the original dwellers of this ancient jungle. It is roughly 8 hours 50 minutes or 460.6 kilometers via Masaka Road to Mbara. This forest is situated in the southwestern part of the country in Kanungu district. In 1991, the National Population Census estimated the district population at 160,700. The 2002 National Census estimated the population at 204,700. The annual population growth rate for the district was calculated at 2.1%. This has been estimated that the population in 2012 was 252,100, with a growing need for health services. Kanungu district is served by two hospitals, known to many as Bwindi Community Hospital and Kambuga Hospital. Bwindi Community Hospital, operated by a non-governmental organization, is located 2 kilometers from the main forest.
The origin of the hospital began when my wife and I came in the year 2000 to do a medical survey on the Batwa pygmies. We stayed here for 6-7 weeks, interviewing the Batwa, and what we found was pretty overwhelming. The Batwa's life expectancy was estimated to be an age of only 28 with an annual income of $25 a year. And it appeared pretty obvious that if not something was done, they would cease to exist as a people. My wife was very afraid of Africa simply because of the diseases she thought she might encounter, because my subspecialty is tropical diseases, and she knew about the diseases of sub-Saharan Africa. But after we'd been here about a month, one night she said, "I feel like I've come home." And then after another week or two, she said, "Honey, what do you think if we return to America, you turn your practice over to your associates, and we sell everything and come out and help these people?"
There were no health centers around. All services were got from far from here, like 50 kilometers. Some of you might know Kambuga Hospital. Some of you might know Chisizi Hospital. Chisizi Hospital is like a missionary hospital. And the nearest health center was Katati, near the headquarters of Kanungu district, as Health Center 3. So patients from here to go to such places was not an easy thing because there was no transport at all, no vehicles, no what. So people here were suffering a lot, having no services. And immediately as we got to the clinic, the number of patients increased because of having nowhere to go else.
Bwindi Community Hospital was founded in 2003 by Dr. Scott Kellerman, a U.S. citizen physician working with the Diocese of Kinkizi, who came to Uganda in the early 2000s.
For the first couple of years living here, it was a very great challenge because there was no healthcare delivery. There were no schools. My wife's a teacher. And so we spent the first couple of years living in a tent, traveling around learning the Batwa's language, customs, and traditions. We do mobile medical clinics, working underneath the shade of a tree right next to the forest. Drums would announce our arrival. We'd see anywhere between 200, 300, 500 people a day. Our ICU was under the shade of the tree. We'd hang IVs from the branches of trees, sometimes securing them with vines, dripping life-saving quinine into the veins of kids suffering from cerebral malaria. This tree was the original tree, and many of the locals call it the healing tree, or the tree of hope, simply because if they brought their kids here, they could be cured. But now they bring them to the hospital where they can get very good quality medical care. It was where the kids would be laying around in mats all around the tree, and IVs would be hanging from the branches. And the other children and adults would be treated who were less severe conditions all around. And we would be surrounded by several hundred people.
From open-air clinics under this tree, the hospital has grown into a full-service institution serving all people in her catchment area and even distant districts across the country.
So after a couple of years of mobile medical clinics, some of the elders approached us and said, would you consider building a fixed facility here? And we raised some money and we thought we'd put up an outpatient unit and a maternity unit because the maternal death rate was fairly high, that if we did that, then our work would be completed. So we put up those buildings, and then people started coming alongside, and the hospital started developing a traction of its own, and it's just increased over the years such that we now have a 150-bed hospital, which is ranked one of the best hospitals in East Africa. Asaf, come on up, here's a man. Let me introduce you to somebody, a quality guy, Dr. Asaf. Dr. Asaf came here when he was a young doctor. He's still very young, and now he's an orthopedic surgeon. He's well respected, not only for his orthopedic abilities, but for his administrative skills.
This hospital has come from very far, from a clinic that was under this tree to now a 155-bed capacity institution. And also, of course, factoring in the fact that over time, because of the challenges we had with attracting health care workers in this place, we already have, 2 schools, a nursing school that is training diploma nurses, but also a clinical medicine school that is able to, give us clinical officers.
He's the head of the hospital, and I can tell you the hospital is in very good hands. And we talked about the trajectory of the hospital, where it might go, and it needs vision. This is a man of vision, he's a man of integrity, and he's my friend.
Thank you, Dr. Scott.
We are happy that all services are done. Health center has improved from not even a health center, but it is now a hospital. Our pupils are just studying from there, and even some have even started working within the hospital. So services are okay because of the nursing school already within the site, the place.
Over the years, the hospital's population has grown to over 100,000 people in its catchment area. To meet the growing and critical human resources for health, the hospital embarked on the journey of establishing Uganda Nursing School Bwindi in 2013, and later the Uganda College of Health Sciences Bwindi to contribute to the equally needed supply of health workers.
Before you start, you make sure the patient is in a semi-sit-up position. Begin from the lobe of the ear to the bridge of the nose, and then down to the symphoid, process all the symphysis, sternum. It is in between here.
This school is a very good school. It has all kinds of facilities that needs for one to perform, and the other thing that is extraordinary and is different from other schools is that they are moving with the technology and
have a strong Wi-Fi that makes students access all the learning requirements, especially online.
The ultimate goal is to have a university where we are able to train graduates that can serve at the level of doctors, nurses, bachelors in nurses, and the rest of the courses that are, essential for this specific setting. But also In our plan is to create a trauma unit where we can handle most of the trauma cases that get referred to the other areas, minimizing the costs.
This is a chemistry analyzer that we are currently using to monitor the functioning of the liver. We use it to monitor the chronic patients. Those are people with non-communicable diseases such as hypertension, diabetes mellitus, and other conditions. We are able to do electrolyte, serum electrolytes. This is our 3-part electrolyte machine. We are using it to monitor our patients in the ICU, in the medical ward, surgical ward, and those that are undergoing operations. We have maintained a stock of blood for transfusion to road traffic accident victims and under 5 children that are presenting with malaria. And for the last 20 years, we have maintained an adequate stock of blood at Bwindi Community Hospital, and we have maintained a minimum of 4 units of O+ units of blood at Uganda Community Hospital. Through collaborations in the past 20 years, we are able to secure equipment that include the reagent storage freezers and refrigerators. We are able to even stock fresh frozen plasma that we currently use for those people that are with platelet anomalies. And this is a unique of its kind in southwestern Uganda and majorly Uganda Community Hospital and then Kanungu district.
According to the Uganda Protestant Medical Bureau rankings, Bwindi Community Hospital has been listed among the best hospitals countrywide in the last 8 years.
How the hospital got started, the growth of the hospital, and you can see the trajectory of growth from underneath a tree hanging IVs to what we have now, and then you have an idea what the future can hold. Where can the hospital go? What other services can be offered? Simply just seeing where it initially started in such humble beginnings. And now we have one of the finest hospitals in East Africa, and we hope to continue that tradition.
We are trying to get equipments. We are trying to get human resource focused on addressing such challenges in this remote setting. We are thinking about, we've recruited a physician, we've recruited a surgeon, we have an orthopedic surgeon. Now we want to, for example, get a CT scan so that we can minimize referrals to the high-end areas.
If someone wanted to donate to a project in Uganda, I would have absolutely no reservation to recommend this particular project. I understand that many people come here from America, from Canada, from other places in the world to see the wild mountain gorillas, which is an amazing experience. But there's so much more to this community than just gorillas. And I would encourage them that if they come here, they should come by the hospital and they should see what's being done here in the community. It's well worth the experience of a tour, and Barnabas does a great tour, and it's amazing. And their donation can go so far to the betterment of the health of the people in this area.
To improve facility deliveries in this underbelly, Bwindi Community Hospital established a mother's waiting area to help mothers from the community.
Now the mother's waiting hostel is a place where our women come and wait for when the pregnancy is term. That means they are reaching the time of delivering. And that helps us in taking away the delay number 2 as a delay in maternal mortality, delay number 2, which is the delay of moving from home to the facility. Looking at the number of admissions in that waiting hostel, on average we have about 40 to 60 women per month waiting, and these are women who are in the last stages of their pregnancy, so they are in transit. For antenatal services, the hospital receives about 250 mothers for antenatal. It comes to delivery, the delivery services, the hospital delivers about 100, an average of 100. And in peak seasons, like the December seasons, it goes up to around 120, 130 deliveries in a month.
Asimwe Justin, a resident of Chabuyoga village, found in Kayonza sub-county, Kanungu district, is one of the beneficiaries of this hostel.
For us here, they check us every day. We go there and they check us to see how the baby inside is, how the baby is breathing, how the situation is. That's the good thing that we have than those ones in the village. And when you get any problem, you can go there and report so that you can get any service that they can see that you wish to have.
By the time we reached, she had spent 6 days at the hostel with her third pregnancy waiting for the delivery day. At this hostel, mothers pay 5,000 Ugandan shillings for all the period they spend before the final day of their discharge.
I'm here to wait as a waiting mother until God wishes for my delivery. And the services here are very good because when you are in equality, you just pay 5,000 for the hostel and then wait until you give birth.
We target risky mothers for example, mothers who have been operated 2 times, mothers who are carrying the first pregnancy, mothers who are young, like someone who is young, who is below 15 years, is not supposed to deliver, is not supposed to be pregnant. But if we find she's of that type, we always encourage them to come to the hospital early so that in case if they get any problem when they are within the hospital, we save their lives compared to when they will be in their villages. In this association, medical insurance, which we call equality, most of them are not registered. They fear the hospital bills. But if it wasn't that, we would be getting most of the people because it is the only hospital in this area.
Bwindi Community Hospital is really doing a lot of help to the community, both to the local person on the ground and also to the guests in the camps which are nearby here.
We have grown our community health network, and the National Community Health Program or the National Public Health Guidelines recommend that for every number of households there should be a community health volunteer or a VHT. That one is implemented here.
One area which we are trying to invest into, and probably which we invested a lot in the past 20 or more years, is local insurance. Of course, we know that healthcare is expensive, so at the hospital we've pioneered a local insurance scheme called Equality. And with this local insurance scheme, basically it helps our patients pay very little premiums, about 5,000, per quarter, and this helps subsidize their cost of care. Of course, we are still having challenges because, the community perception of the health insurance schemes is still poor. So that's one area we are also investing a lot of our time.
The Mothers Waiting Home and Mama Alive Initiative Award led progression to skilling mothers.
This project was meant to reduce redundancy amongst women who come for waiting hostel and to reduce maternal death both for women and newborn babies. Yes, and to make it productive to women. When they go home, at least they can earn some money when they are making this craft work to sustain their families and look after their babies.
When I have this experience and I'm in the village, I will be able to get the money that will help me to buy some needs of my family and what the baby needs. I will be able to get the money.
The population in this area is predominantly for subsistence farmers, and most of them live on less than $1 per day. Here, many people travel long distances, ranging between 20 to 50 kilometers, in search for health services. The hospital's catchment area is over 100,000 people, spanning from Kinkizi West constituency. The hospital offers between 30,000 to 40,000 consultations throughout the year.
Every service is subsidized, because at any level, consultation is subsidized by 80%. So if it was admission for any condition, be it accident, be it a surgical condition, you find if someone was paying 50,000 per night, an insured person just makes a co-payment of 5,000.
Our Child Health Access Project, CHAP, helped reduce under 5 mortality, and we received a STARS Health Impact Award for Africa and Middle East region, which led to Equality Community Health Insurance as an Innovation in Healthcare Financing Award.
The mothers, those that are giving birth, and also the children that are under 5, then those that are either the newborn, the prematures, they enjoy the greatest subsidy, because we know that life starts with the mothers and the children.
We have engaged Bataka leaders in collecting vital statistics for every birth and death of children under 5 years, as well as recorded all maternal deaths in our community, and collaborated with community health village teams or volunteers for community action.
Here in Kanungu, in Bwindi, we have bigger families. We again subsidize, and each member pays 12,000 a year. That is 3,000 every 3 quarters. And that is through the Bataka groups, what we call the Bataka Twezike.
Through our Health for All program, we developed a mobile community health information system, MCHIS, for real-time community participation in health awareness. This award was given by Grand Challenges Canada. From MCHIS to Mobile Health mHealth research collaboration to include disease surveillance in the context of One Health. The scheme has gained momentum for the past years, now serving over 25,000 people annually, improving the health-seeking behaviors of the locals.
Yeah, since 2010, the scheme has been growing, and as I talk now, we have over 28,000 paid up members. 28,000, each pays 5,000 quarterly, and they are on the scheme and they are getting the services.
Innovations in teaching at our training schools with helps of smart boards, dual qualification, that is to say sonography and family planning proficiency, thus avoiding cyclic learning. Areas of specialty service areas that have helped bring the needed care in the region, areas including neonatal care unit, intensive care services, ICU, specialized surgeries, fistula, orthopedics, urology, laparoscopic surgery, among the many. Today, Bwindi Community Hospital is staffed by a dedicated team of 209, including doctors, nurses, midwives, and support staff. Located in the southwestern corner of Uganda, this hospital cares for over 120,000 people annually. It's a place where lives are transformed and hope is restored. With their driving mission of serving Jesus Christ through giving holistic health care and life in all its fullness, they envision a healthy and productive community free from preventable diseases with excellent health care accessible to all.
Ugandans, even though they're faced with a lot of challenges, they're singing, they're dancing, they're banging on the drums. We start the hospital every day with singing and dancing and sharing and praying. And when I'm coming from America, we don't do that, but we do it here. And it's just a sign of the joy. It's a sign of the joy of delivering quality health care. It's the joy of us working together. And it's the joy of just working in a compassionate environment. So I think if you come to Uganda, if you're not having joy, you're really missing out. Because this work here and the environment and the life here is filled with joy.
We are headed to beginning a university teaching hospital as our midterm goal, starting vision and dental specialized unit, generally a full-fledged regional center of excellence in tertiary healthcare, health innovation, research and training the next generation of health professionals. All this feeds into our vision of a healthy and productive community free from preventable disease with excellent health services accessible to all. As the institution celebrates 20 years of its founder, Dr. Scott Kellerman notes collaboration is at the heart of the institution's success. working closely with various partners to achieve maximum efficiency and effectiveness. 2 kilometers from a dense forest, Bwindi Community Hospital stands as a beacon of hope, a testament to the power of compassion, commitment, and collaboration. It's more than a hospital. It's a lifeline to a community and a symbol of what is possible when people come together to make a difference. Bwindi Community Hospital, where hope and healing thrive.